Community Healthcare Clinic has been involved with Mennonite College of Nursing. Our Dean, Judy Newbrander, served on the board of directors for Community Healthcare Clinic and was very familiar with the services they provide, and saw this opportunity where we could partner as a nursing school with the clinic and offer education to students. Oh, it's such a large realm of nursing that our students aren't exposed to. Traditionally, students have mainly been exposed to the inpatient setting where they're providing care to hospitalized patients. To bring them into a clinic where they are seeing the whole other side of how we take care of patients outside the hospital is invaluable.
It's just such a different place to work. It's a totally different world. You're working with a very specific population of patients, with a lot of immigrants and Spanish-speaking patients. You're doing the long-term management rather than the acute management in the hospital. So you're seeing patients come back over and over again, and not just dealing with them that one time in the hospital and then seeing them go.
So specifically, I got introduced to the clinic through one of my professors, which she was like our internship coordinator through ISU, because I was a public health major. So public health is a pretty broad major when it comes to a lot of stuff. I didn't really want to be stuck in an office like other places. And then when I got introduced to the clinic, I got introduced, and I didn't know anything about the clinic. I didn't even know that it was here, and I lived so close to it. She was able to kind of tell me about the patient population, the needs of the clinic, and then just a kind of broad overview of what the clinic did for patients, and that's what got my attention the most.
With my studies at ISU, I had a Spanish minor, so that was something I was always looking for ways to connect and find a way that I could use my Spanish-speaking abilities. And this clinical I had in school was the only place where I was able to use that. So once this opportunity came about, I was looking to get away from the bedside, find something that felt meaningful to me and use my Spanish-speaking abilities. And this just was the perfect place for me to come.
I was originally very clinically focused. I wanted to go into private practice. And throughout my internship here, I have opened my eyes to really wanting to work with immigration as well. As a Hispanic myself, I always knew there was a need for that, but never have I done it so directly, where now I definitely want to explore more of that avenue than just therapy.
So what I like the most about working with patients here at the clinic is that we come from a very shared background. So I'm able to share my experiences of me growing up, where I'm from. I'm Guatemalan, so I didn't really grow up with a lot of Guatemalan people around me, because I'm from Chicago, and unless it was my family. So being able to see that there's a pretty big Guatemalan population here kind of makes me feel at home. It makes me feel like these are people that I can talk to and relate to more.
One thing that was so special in my heart is I was with a student in a room, and I cannot speak Spanish, and I was there to help the student, making sure that they were okay doing their vital signs. They didn't have any questions about more the technical aspect of what we're teaching students to do: blood pressure, temperature, vital signs, pulse. And the student, the minute she started communicating with the patient, it was like the patient was completely at ease because of that Spanish language barrier, and having somebody give that effort to the patient, so enlightening. You could see the comfort on the patient's face, and that's what the spirit of nursing is, to really have a relationship with patients and show them that you care.
Being able to build rapport with a patient is so important, and when they can speak your language and you can speak theirs, I think that opens up a whole new set of doors. They're able to really be themselves. They can explain things without things being lost in translation. They just feel more comfortable overall. I've seen it when I do intakes. I ask them if they need translators, tell them that a medical one is always provided. I can see the relief in their face. I think that it really just makes them comfortable and feel like they're in a safe space, which they are.